had a heart attack 3 years ago. My doctor has tried to put me on 3 different statins and I can't take them because of horrible leg pain and insomnia. How concerned should I be? I am already following a healthy diet and hope that's enough. Hello, my name is Alexander Postalian. I'm an interventional cardiologist here at the Texas Heart Institute in Houston, Texas. And welcome to Asked and Answered, where we try to answer patient questions that are common and some that are not so common. And hopefully we can make sense of some problems that some folks are having. Cholesterol medications are a big topic. We talk about it. I talk about it multiple times a day. I almost have, speech number 4 in my brain ready to go when we're talking about cholesterol medications. So you had a heart attack. If you had a heart attack, then you are in a different category. It's not like somebody going on the street, hey, you need to control your cholesterol and this and that. It is a much higher risk situation. We're much more strict with cholesterol control, blood pressure control, medications, etc. And statins are classic, well-studied medications to lower cholesterol and lower the risk of heart attacks. In the past, we used to think that statins caused bad side effects in about 30% of people. And over the years, if I were to summarize the evidence somehow, what we've done is essentially, it's not exactly this, but if you add them all together, we took a bunch of people and we gave them a statin and told them, here is a statin. And then we took a bunch of people and we gave them a tic-tac and told them, here is a statin. And a lot of people taking the tic-tac, almost as many as the ones taking the statin, above 20%, had to stop the tic-tac because of unbearable side effects. So that's called the nocebo effect. You think something's gonna harm you, and because there's so much evidence out there and you're aware of the issues with the medication. So that means that the side effects are not really 30%, it's much lower than that. That's important. The other side of the coin is some patients do get really bad side effects from cholesterol medication. And fortunately, we have alternatives. And lately we've had some more. For example, PCSK9 inhibitors, which are injections every 2 weeks. A medication called inclisiran, which is an injection every 6 months. We have other oral drugs like bempedoic acid, ezetimibe, and some others coming down the line that can be used in patients that cannot tolerate statins. So if you've had a heart attack, I would be very careful with stopping drugs unless it's under supervision. And just know that if you haven't tolerated statins, doesn't mean that you won't tolerate them now, but if you truly cannot tolerate them, there's alternatives. I just wouldn't go untreated and let your cholesterol run high and increase the risk of having another heart attack, okay? Well, this has been great. This has been a pleasure to be here. I love doing this. So please send any questions. It can be anything cardiology related. High blood pressure, diet, medications, testing, valve issues, pacemaker issues, heart failure issues, exercise, questions about limitation or what can you do, etc. Just send it all. We'll be happy to look it over. Maybe they'll feature in our next session here. And again, this is a general discussion. So if you have any symptoms like chest pain, shortness of breath, it's always good to talk to your doctor. And remember that every patient is an individual. So while we can make general recommendations, in the end, we always make an individual recommendation for a specific patient. So when you're watching something, asking a question, just keep that in mind. We're giving you a general recommendation, but if you want a specific one, talk to your doctor.